So after finishing two topics that are, first was depression, we have finished. Then we have finished the bipolar diseases, where we have seen the mix of mania and depression. When we discuss bipolar, usually we do not have major treatments for mania as such, but anyway we shall see about mania again. Mania needs particularly agents which can calm down the patient. We call them as a tranquilizers. We shall see them after this, but mania is comparatively smaller one. Then we will go for the next, that is schizophrenia. So schizophrenia is one of the very known psychiatric disorder, and it has got very typical signs, symptoms. There are many etiological factors are associated with it. How we will diagnose it, and let us see what can be the various situations of treatment and care plan into it. In all cases of this psychopharmacology or psychiatric diseases, whether it is depression, whether it is bipolar diseases, the most important thing is care. Care is important in all sense, because this patient has to be, although they do not look as serious, but many serious things are actually there. Because maybe in cardiovascular with ECG or some other factors, you may say that no, the condition is serious or like that. Here we never understand, we never know what is the situation, what is going out in mind, and all of a sudden it can be very dangerous one. So care is important in that aspect. Though person looks physically very fit, but the mental fitness is important, and therefore these various care are there. Same thing we have discussed as a part of cognitive behavioral therapies and all. So let us see one after another what are these. So schizophrenia is around found in around 20% of the people who are known for psychiatric diseases, if we go for 12 months period. And most prevalent of that is anxiety disorders, then next to that are mood disorders, then alcohol disorder, major depression. These are other disorders which are comparatively more predominantly than schizophrenia. It has got comorbidity. If you remember, recently we have seen, when we are seeing the bipolar diseases, in that we have seen the diseases, we call them as a schizoaffective diseases, that is schizophrenia plus affective disorders, or depression or bipolar depression or bipolar disease. So simultaneously, when they are mixed, when they are combined, then we call it as a comorbidity or common disease. Only 60 to 80% of the people seeks the help and they get benefit out of it. Others may not even aware about it, and they try for many other things. We shall see symptoms, then we will discuss it more. Now how we can go for the determination. So we should have to know what are the what this disease is. Then we have to communicate with the person, the relatives, to understand. Then we have various criteria, maybe DSM-6, DSM-5, DSM-4, whatsoever available, and on that basis we are going for diagnosis. We will go for diagnostic criteria separately. We have seen in depression there are many scales or this are there. So similarly we can have here also, there are variety of scales are available. We can check it, then check the behavioral activities, subjective and objective, and what can be the etiology. Try to, because there are many etiological factors. Usually it is genetic in most of the cases, but those who can check it is very good book. I told you earlier also, but I will repeat. One book is there by Stephen Stahl, that is Psychopharmacology by Stephen Stahl. Most probably it was available as a PDF copy at somewhere. So this book was giving very good graphical picture, what can be the etiological factors or what can be the reasons behind various psychiatric diseases. I could not see the recent version of it, I have used it while teaching it almost 20 years before. So that book was very good. That book was showing very good relations between various factors that will be etiological factors for various psychiatric diseases. So let us go for the schizophrenia. What it is? It is the most debilitating mental illness. It is obtained from Greek term, that is splitting of the mind, or it is also called as a split personality. These people do not have more than one distinct personality. The distortion in their perception, feelings and relationship with the world around them. 1% of the population overall, if we calculate, see earlier when we called it as a 20%, it was from all the psychoaffective diseases. Whatsoever psychiatric diseases are diagnosed, out of that 20% are schizophrenia, while when we take all the population overall, then it is around 1% that suffers from this population in given 12-month period if we check it. Now we can have again categorization of it. It can be mild, it can be moderate, it can be severe, and if it is beyond that, we call it as a psychosis. These are various terms. These initially milder level, it is anxiety. Slowly as it goes, then anxiety disorder, somatoform disorder, dissociative disorders, this will be there, and this anxiety will cause changes in the physical condition and the personality disorders. Then the conditions like grief or severe depression like thing can be there. So mental health should be observed, it should be verified, and one can go for more diagnostic test and continuous observation, continuous support in this condition. So epidemiology, now again here 95% means that whatsoever 1% of the population which was having. Now if we consider all these as 100%, then this 95% of the sufferer, they last, this schizophrenia lasts till lifetime, means it is not curable. 1/3 of these people, particularly who are homeless, they suffer from schizophrenia. They have more chances of this because again stress factors and loneliness and all other factors are there. 15% they do not respond to any kind of medications. 75% are having partial effect on because of the medications. 20 to 50% of the overall patient, they attempt for suicide, although it is not exactly depression. It has got so many simultaneously changes in the CNS are there. So they attempt suicide. Out of that 10% they are successful in the suicide, that means they 10% able to kill themselves. 20% life expectancy is shorter in these people. Suppose if we say that life expectancy is around 70 years now, so they will have around 14 years lesser than other people average. 25% experience secondary depression, and that secondary depression results into suicidal attempts or suicides actually. Now what are the causes of schizophrenia? I told you the most important reason is the genetic factors. In that the area which are responsible for various emotionals and various factors, these areas are having different kind of neurotransmitter releases. Then chemical imbalance and physical abnormalities like neurotransmitter, brain structure, this can be seen. Biological factors like age, some diseases, some infection like viral infection, etc. Environmental factors like chronic life stressor changes, etc. As I told you, if you will see the style, you will see all these picture depiction, and if there are more than one factor there, that means the people they will have more and more chances, or more and more severe it can be. So if genetic factor plus chemical or physical abnormality is there, or any chance like trauma or any such thing happens, or any drug which can cause it, exacerbate, or we call it as a resurfacing of that disease, which was unmasking rather we call. So normally it should not have shown sign, but when these drugs are given, this may cause unmasking of the problem. So genetic was already been there, then because of either chemical imbalance or any other causative factors, or because of the virus, or because of the nutritional this one, or stressful environment, maybe the person is abused, or has been thrashed, or having a very wrong type of treatment for long period of time. So there are so many factors which are there. These are all etiological factors. So these are various activities. What are chemical imbalances? That means the neurotransmitter levels, they changes. Example, dopamine level increases in some or other places. Organic factors are there. Then physical abnormalities are present in brain structure. Some of the changes are there. Example is increase in ventricular brain ratios, brain atrophy, that is some of the portion of the brain is atrophies. You must be knowing this word. Atrophy means functionless. Okay, just it was atrophy of gland word was used many times, that glands are atrophies means there will be no secretion from these glands. Similarly, brain atrophy means from that area no activities or no big work is there. There changes in the cerebral blood flow, particularly decrease in the cerebral blood flow. These are the various reasons behind this. Then the biological factors like chemical structure changes in the body, teenagers onset, because these are again hormonal changes, they are occurring during pubertal period, viral infection in mother during pregnancy. Then environmental factor like psychodynamic theories are there, like event stress, emotional strain, personality development. I told you Freud and Erikson, they were the psychologists. They they stress that these are the one of the important reasons. But then when we find it now, there are many reasons are there, and most of the times there are overlapping, or there is more than one factor, either less or more responsible for that, and all these factors are doing. One scientist Sullivan also work on that personality development. Then there are family theories, that is double bind theories, blame theories, dysfunctional families. So as I told you, family relations or childhood abuse or such things are there. They are all responsible for this kind of schizophrenic development. So these etiological factors, if they are there, maybe one cannot change it back, but yes, they can give very good idea, very good clue to the treating doctor that what is the etiological factor, so that they can think about it, they can plan further things. Now if we say that genetic influences are there, how it can be confirmed? That is, when it was found that if there are identical twin, then almost 50% of chances are there. If one is having schizophrenia, other will also have. Then fraternal twin which is affected is 15%. When both parents are affected, then there are 35% of the chances. When any one of the parent is affected, there are 15% chance. If the brother or sister is affected, then there are 10% chances are there that other brother or sister will also be affected. And if there is no affective relative, then there are only 1% chances. So you can understand how the genetics are playing importance, or how it is responsible for the reason. Then yes, signs and symptoms, what are there? Alteration in the personal relationship. So these are there. The behavioral is totally different, not behaving properly with any person, with even relatives. Alterations in the activity, that is the people will have totally different activity, or rather most of the time they are useless activity, or they are not fruitful, or they are not functional activities. Even if somebody educates well and goes for any job, then there are chances that the person will not do the job in correct way as it is expected in the job responsibilities. Altered perceptions, this is very important. This one, there are many perceptions are there. They may have this sound or visual perceptions, which shall see, we call it as hallucinations. Alteration of thought, there are many stories. If you go for the case studies, when that you will find that this how these case studies are describing. You may feel it interesting, but then again it is a disease, that how they change their mind, how they feel that somebody is going to kill them. These are all perception or thoughts are there. How they feel that somebody near and dear is involved in a conspiracy against them, like that. So this type of thinking is there. The thinking can go distorted, maybe friend at this moment and can be foe at or enemy in the next moment. So these are distorted thinkings are there. Altered consciousness, become over conscious or accordingly, and there all the mood changes, so affective changes are there. There are such kind of changes which are seen in the people, and you can see them in really very good way when you can see, or you can go through the various symptoms or interviews are there with these people. So this is scientist, that is blue Laras. It gives 4 A's. That is, these are very important aspects in that. That is, first is autism. There is a preoccupation with the self and little concern about the external reality. So they are always imbibed in self. They feel that whatsoever is there, they are with their self only. They are occupied with. What is happening to them is they are concerned about. They are least concerned about the other one, maybe whatsoever near and dear they may have, and this is very dangerous, very severe one. Then associative looseness, that is the stringing together of the unrelated topic. Maybe I remember while long back, while when I was a student, somebody explained me schizophrenia case like that, that there was a group of people, and one get pain, maybe good looking pain, the person who was schizophrenic. Then all of a sudden good looking pain was there, and he gets, as I, if you remember the preoccupation with self or the thought, then the person gets into affection with the pain. That very good pain is there. Now suddenly if somebody, even very good friend, will say what a good pain it is, very beautiful pain, even without innocently, then all of a sudden these people, this fellow may feel like that, that okay, he is saying, he is praising my pain, he is praising my pain, then it may be, he may be having an eye on it, he may steal it from me, and if he steals, then what I will do? And maybe then it can go to any extent, even they may feel almost killing to the friend. So this kind of thinking, which normally one cannot go for. The matter was very simple, that he got a pain out of just courtesy, or like that somebody said, no, what a good looking pain. Then going up to that extent, that he is my enemy, he wants to steal my pain, he doesn't want to keep very good pain with me, and if it grows, if it goes beyond control, then up to whatsoever extent it can go. So this type of unrelated topics are there. All of a sudden, or whatsoever means, the what we can say, the thinking is very very absurd. Thinking is very very irrational is there. Then simultaneously opposite feelings are there. Means he was a good friend at one time, he can become enemy in the next moment. So simultaneously opposite feelings are there. Affective disturbances, that is appropriate, blunted or flattened affect, means they may not have any concern, or they may almost neutral to any kind of relations. All of a sudden they can become very cooled or passive with that. So this is an appropriate or blunt or flattened affect, or these symptoms are there. So these are 4 important A's are there, which are seen, which are observed in the people. There can be positive symptoms, like we have seen what is positive. That means where the overall activity increases, then we call it as a positive symptom, like mania we have seen. So any kind of energy level increase, or any kind of activity increase, talkativeness increase, any kind of, whether eating is increased, sexual activity increase, everything, whatsoever, anything out of this when it increases, then we call it as a positive symptoms. So these positive symptoms are recognizable. As we have seen, when it was hypomania, sometime it was not recognizable. Here these positive symptoms are recognizable. Example, positive type 1 type of symptoms are delusion. These are fixed, delusion means fixed false beliefs. Okay, they feel something different. They feel that you might have heard again cases. They feel that they are something big one. They are almost president of a country. They are prime minister, chief minister. They are something like that. This is delusion. They are main. They are something very important. This is what we call as a delusion. Then next is a hallucination. That is a false perception. What is it is? They feel that God is talking with them, or there are some voices, or people say, they say that they have seen that there was some entity from other planet was going to meet him or kill him, or to shower some thing on it, just like that. It will say that even they have heard the word, they said that I have spoken with that particularly thing. So it may be God, it may be demon, it may be any kind of thing. So like that, it can be devil, whatsoever it may be. They can have voice, they can hear, or they can see anything. This is believed because of the excessive dopamine in the limbic system. If you remember anatomy, physiology, then limbic system is the most important prominent area for the emotion. So I told you earlier, so emotional area, wherever the emotional area is there, when we have seen the etiological factors, then the area which is responsible for the emotions, that area will have a problem. So here there is excess dopamine in that limbic system, that causes embellishment of the normal cognition and perception, so that affect that goes beyond it, and they are responsive to antipsychotic drug. If we want to treat it, we can treat it with using antipsychotic aid. Then there are negative symptoms. What are they? Lack of affect of energy, I told you, that is lack of binding. Affect means here affection, what rather we call as. So lack of affect or energy. Attribute to cortical dysfunction, that is atrophy in cerebral cortex. There is a decrease in the cerebral blood flow. It can be increased. Just a minute. Hello? Huh? Huh? Bola. So these are the symptoms, that is lack of affect or energy. Then these are because of the cortical dysfunction, that is atrophy. Why atrophy? Because of decrease in the cerebral blood flow, increase in the ventricular brain ratios. Ventricular brain ratios means there are ventricles, you may be knowing anatomically, through which the cerebrospinal fluid is circulating. First ventricle, second ventricle, third ventricle, and accordingly the ratios are there. So this ratio will be there. Then hypodopaminergic state is there. Overactive glutamate is present in some of the area like prefrontal cortex. It stimulates the dopamine receptor in the limbic area. And the secondary to the medication, hospitalization, loss of social support, and economic decline, like that, these are the factors which are there, and accordingly they should be also simultaneously taken care of. Poor attention is also correlated to the negative symptom, because they are not attending. If somebody say that somebody is not attending the important session, or at that time the thinking is going on somewhere else. So this is their constellation of negative symptoms and cognitive impairment interfere with the quality of life and social relationship. Just a minute. Just a minute. Hello. So this is the reason there is a poor attention, that is correlated with the negative symptoms. And this constellation means, you might have seen, we call it as a constellation of stars, like that. That means coming together or making a particular specific type of activity. We say that there is a constellation of stars are there in the sky. So here constellation means when these all different kind of negative symptoms, they come together, they make a cluster, and they causes cognitive impairment. They may interfere with the quality of life and social relationship. There are negative symptoms, they create serious barriers to independent living and working people. These are what various problems they are having. Negative symptoms pose fundamental challenge in many ways, more particularly than the positive ways. It does not inspire the person in same sense of urgency as positive symptoms, and it draw less attention from the staff. So if the person is, but then they are more dangerous because it can even lead to severe activities. The overactive glutamate in the prefrontal cortex stimulate the dopamine receptor in the limbic area, and that result into the negative symptoms. So these are various reasons, these are the various causes which are there, which has to be checked place. Then next is, what are various diagnostic criteria, how we will diagnose this. So, hello. और करने दे 2 सेकंड और करने. So these are the situations, and we have to see the what are the diagnostic tools for that. So at least 2 of the following activities should be there, like delusions, hallucination, disorganized speech. Disorganized means it is very irrelevant, grossly disorganized or catatonic. Catatonic means the overall activity is less, or means very depressed type activities are there and negative symptoms are there. Then social or occupational dysfunction, because this we cannot have the person in the occupation or job or society also, because behavior with the either people, maybe relatives in the society or the neighbors in the society, and occupational that is with the job whenever going, so cannot perform in that, and these are the social or occupational dysfunctions. When these signs are there which are continued for at least 6 months, then it is almost sure case of this, because it is not once or while, it is not episodic one, it is a continuous one. It is not caused by substance abuse or general medical disorders. Example, substance abuse, as I told you, there are drugs, we call them as a psychoactive drugs or psychotomimetic drugs. If you have studied them in pharmacology, there are many such drugs are there. Example, we have discussed them, like methylphenidate, or people take like amphetamine, or various drugs of abuse like methamphetamine, and many like that. So these are various drugs. If the whatsoever actions are there, they are not caused by substance abuse. So this type of narcotic substance, the person is not taking and still it is behaving in this way, or there is not any general medical disorder. Maybe what general medical disorder can be? Example, these are autism like disorders, there are cerebral palsy like disorders where the brain is not properly developed, and it is diagnosed in that way, that the person's brain is not particularly developed, or there is a problem, and it is from the childhood. But particularly this happens that earlier it was good, the person was very good, and all of a sudden there is a change like that, or slowly the changes are being noticed, and by the 6 months it has been grown to a full one. So this type of the situation, when it is there, we call it as a diagnostic criteria, it mentioned. Then various prodromal symptoms, that is a month or year before the onset, before that what sort of symptoms are there, we can check this. The deterioration in the previous functioning, withdrawn from the others, becomes lonely, it becomes the person becomes depressed. Vague plan for the future, if asked something like that, then cannot tell anything, will do this, will do that, like that. Neurotic symptoms like there is anxiety, phobias. Then it can be this anxiety or phobia can be either acute or it can be chronic. Then there can be difficulty in concentration, misinterpretation, then feeling of rejection, lack of self-respect, because again this is a cyclic process. The behavior of the person changes, so people try to keep away from the person. They are keeping away, so if the person feels that there is a rejection, or people are not liking the person, and because of that again there is exaggeration of this, and this cycle repeats, and it can be a dangerous one. So this happens, the feeling of rejection, lack of self-respect is there. Now, what is the prognosis? Prognosis will be the function of the pre-morbid personality, means before it becomes morbid. Morbid means hospitalization. So, when it will be the depending on the pre-morbid personality, age of the onset and time of the therapeutic, how much therapy is going on, accordingly we can, or time of the treatment it will give. Younger is the ends of action. Most discouraging is the prognosis, because most of the time these neurons are going for continuously damage, and then the prognosis is not that good. Prognosis, you must be aware of the word prognosis. That is, prognosis means what is the outcome of the disease after treatment, whether what's the treatment or intervention has been made, what is the outcome, whether the prognosis is good means yes, person is going out of the disease, person is 100% good prognosis, that means the person is totally out of from the disease. But here the prognosis is discouraging, that means there are no good signs. Even though therapy is there, it will just control the disease, but not the continuous, will not cause the complete relapse or complete relief from that. So, evaluation of outcome can be done on the done, and it has to be checked that whether the person has returned to pre-morbid condition. Even that much is a benefit, because after pre-morbid, morbid means hospitalized, and with the treatment, if even the person is returning to pre-morbid or prodromal condition, that is expected, or that is good one. Then what are the subjective signs? These are reported by the client, or that means patient or patient's relatives. These are altered perception, thought process and content, consciousness and affect. These are all altered. We have seen it recently. It may induce patient to seek psychiatric help, and because of that patient is taking. These are all signs. These are this is sort of SOAP we are going for. Then what are the alteration in the thinking or perception? That is thought broadcasting. Broadcasting means so many things are simultaneous, though so many thinking, so many most of them are absurd. These thoughts, they do not have very much relevance, but so many are, means no control of thought is there. How whatsoever irrelevant they may be, but it is not there, and it can be seen from the speech or whatsoever. If somebody talks with the person, then can see the irrelevance, how big irrelevance it is. Then thought broadcasting, then thought insertion. All of a sudden, in a mid of the thought, some other thought is put into. Suppose somebody is discussing about environment, and all of a sudden, some will be all of a sudden coming for maybe a movie, or maybe some war. So like that. So thinking, or maybe this is totally absurd type of is there. That is what we call as a thought insertion. Thought withdrawal means some thought was there, some discussion was going on, all of a sudden that will be stopped, that will be broken. Delusion of being controlled. Many times they feel that I am controlled by God, I am controlled by some devil, or I have something like that. Then the delusion of persecution, grandeur. Persecution means they feel that they are persecuted, the people are after them, since they are many times they feel dual feeling is there, grandeur plus persecution, both they are having. Maybe just like they are something like they are some big old king, or some big old personality, or maybe president, prime minister, or even beyond that, maybe God, maybe something like that. This is called as a grandeur. Grandeur means larger than life. Whatsoever they are, they feel that much better than that. And simultaneously other feeling can be there of persecution, that he has got some enemy into that. He is a king, he is a big king, he has got a big kingdom, and his maybe minister, or his some courtier who is against him and can kill him at any time. So they continuously remain suspicious with the people, and they always feel that somebody may be poisoning them, somebody may be trying to affect them. So these are the delusions are there of persecution. Ideas of preference, somatic delusions. They feel that there are some changes are there. There is we have seen associative looseness just before that. That is the relations wise and the talk wise, that there is no association, there is no referencing of it, that there is a concrete thinking is absence, then that association and word salad, the word is used, that is the word are mixed like salad, which may not be complementary to each other. So word selection is not also a proper one. So these are problems which are associated with this. Then alternation in perception and behavior, the most common, most problematic are the hallucinations. This can be either auditory, it can be visual, it can be olfactory, it can be gustatory, it can be tactical. You must be knowing all this. Auditory means they are hearing sound. It may be from God, it may be from their enemy, it may be from something, it may be from devil, it may be like that somebody king or somebody is calling like that. So these are audio. They can see some God is talking, some other entity, or what we can say extraterrestrial object. They can see that some EFO has come to pick them up. Anything. These are just few examples. As I told you, if you go for the cases, just to check what kind of cases are there in schizophrenia, and then when you check the cases, then you will see their complaints at the time of admission. Then you will realize, and many times they are very serious. They are, nobody can show disbelief in their way. They may feel that olfactory, that some sensation is there. Olfactory means smell sensation, maybe burning sensation or any other kind of. They may feel that the God is showering some scent on them, like that, anything. Gustatory means related to taste. Tactile means touch. So somebody is touching them, somebody is like that. So this type of all hallucination will be there. The behavior is bizarre. It can be extreme motor agitation. So too many movements are there, and many times these movements can be good. This means simple movements, or it can be somewhere dangerous movements. There is a stereotype behavior. Doing same thing again and again is a stereotype behavior. There is a automatic obedience. That is only automatic or autonomous nervous system wise they are working. Then flexibility is different. Stupor means you can see stupor is a facial this one expression, or expressionless face, we can call it as stupor. Negativism, they do not appreciate anything. Always negativity is there. Behavior can be agitated. There is a poor impulse control. All of a sudden can get anger. Then objective signs, they are observed directly by the nurse or the attending staff. These are like altered relationship, alteration in hygiene, social skills, communications, and psychomotor activities. They can frighten others. They may lead to involuntary psychiatric interventions. So they may do it like that, so that people get frightened with them. So there are various subtypes of schizophrenia. One is a paranoid, where they are preoccupied with one or more delusions. That means, as I told you, God is speaking, or somebody is showering some scent, and some God is coming. So before God, they will feel that some scent is coming, like that. Some taste is there, or they will feel that some taste is there. So these are different kind of taste which are there. They will be disorganized. Their speech is disorganized, behavior is disorganized, attention is poor. If somebody is trying to tell what's very important, they may not attend it. Inappropriate affect means they may not have good connect or good linking with people. Catatonic, that means waxy flexibility or purposeless excessive motor activity is a catatonic. Then stupor, as I told you, expressionless face, mutism. Then there are some undifferentiated activities are there, and residual negative symptoms are there. We have seen negative symptom. So undifferentiated type, that meets criteria for schizo, but it does not meet criteria for paranoid, disorganized, or catatonic. So what's not coming into this, neither paranoid, not disorganized, not catatonic, then we'll put it them as undifferentiated, but it is a schizophrenia. All our other diagnosis will confirm that the person is having schizophrenia. So these are all various activities. We already seen schizoaffective disease, as that is schizophrenia plus bipolar diseases, and particular depression is more delusion disorder, delusions that have basis in realized but not it is a schizo, a brief psychotic disorder, psychosis last which is less than 1 miller, then schizophreniform disorder which is around less than 6 months or more than 1 month. Then because we have seen that it is more than 6 months, then we completely call it as schizophrenia, but here it is if the duration is less but the some of the symptoms are like that, then we'll call it like this. So how we'll diagnose it? Again, ultra nutrition, normally they take less nutrition than the body requirement. There is a risk for violence directed either on self or other, because as I told you that they may feel that there is a threat from anybody, maybe even near and dear, so they can attack on that, or because of the depressive episodes they can have their own self-inflicting injury. Then self-care deficits like feeding, bathing, dressing, grooming, toileting, they may not they may not able to feed themselves well, they may not bath, they may not dress. If you might have seen the people, particularly homeless people, as I told you, and they are wandering here and there at many places, either with clothes, without clothes. If you see how they are eating, whatsoever they get, whatsoever food they get, then what is their style of eating, what they are toileting, all these things you will find that they are not as per the societal norms or societal standards. Then usually they have non-compliance with the medication, they do not take medications regularly, and therefore the cure rate is always affected. They are ineffective individual family coping, because they cannot cope with the family well. Just a minute. Hello. हाँ बोला मैडम. So this is how what we can do is diagnosis alteration in nutrition. Risk of violence is there either towards self or others. Self-care deficit we have seen, non-compliance with the medications, ineffective individual or family because they cannot do many of the work. So as an individual also they cannot work. If they cannot work, they cannot earn, means again they cannot live with that standard. They cannot behave well with the family, and therefore they becomes separated from everyone. Self-esteem is disturbed because nobody can go near them, with the fear also and type of the attitude they are having. As I told you, self-care deficit. So if they are feeling like that, they are not bathing, they are not dressing well, or even if some new clothes are given, they will just they will not maintain a good sense of it. Then in that cases nobody will go, so there will be self-esteem disturbances, and as I told you, altered thought process. So these are situations are there. Particularly in paranoid condition, violence is directed at self and others is more, because in paranoid they are thinking that somebody is always there to harm them, either from God or from devil or from nearby relatives. So in that cases, that is the biggest problem they have. So what thing we can do, we'll see from this, that is therapeutic management, from our next class. So these are what the therapeutic management we shall be doing. That is what is supportive care, how we can strengthen self-esteem, how to treat patient as adults, how to prevent failure in embarrassment, respect individually. These are various aspects, and other treatments are there. So this can be seen in the next class. What I observe is many times students join and they all of a sudden start leaving.